I've submitted my formal reports. This you are listening to now is my public one to bring awareness and fair warning to the potential dangers behind the closed doors of an ICU and the lengths of which this Illinois hospital went to downplay their actions. For context, my mom is 75 years old and has advanced ALS. 4.5 years I have lived every day of it with her, alongside my dad and younger sister, who is high functioning on the autism spectrum. We are and have been her full time caregivers, and she is the center of our world. The day I heard her diagnosis, my heart shattered. I remembered back to when I was younger. Stephen Hawking came up in conversation, and Mom said he had Lou Gehrig's disease, as ALS is also commonly known, and explained what it was and how terrible. As the disease had progressed, I've watched my mom become paralyzed with only a small bit of mobility left to tilt her head slightly to the side. I've lived through her losing the ability to speak verbally, learned how to program a Tobii Dynavox eye gaze tracking AAC computer software so she can talk with a synthesized voice, learned how to crush up her pills and give her fluids through a feeding tube in her stomach, rock her back and forth on a bedside commode, which she is no longer able to do as of the end of June after going to the hospital, and even how to suction the back of her throat when her lung muscles deteriorated to the point she was dependent on us to make sure she didn't drown in the mucus she couldn't cough up by herself anymore. A bit more critical information. Mom had been struggling with long coughing fits that required suctioning, and despite mucus medication, increased nebulizer treatments, and cough assist machine use, things didn't settle down until her home healthcare doctors took us seriously and ran an x-ray that showed clouding in her right lung. They prescribed 1 week of antibiotics, which cleared up the coughing fits, and shortly after they returned. The doctors ran another x-ray and determined it was clear, no more clouding. Mom started to want to use her BiPAP more frequently to help her breathe easier. She started to develop a pressure sore from the full BiPAP face mask. From the start, one night, spontaneously, my mom wasn't responsive. My dad was doing the typical inside the mouth wipe out after her pureed dinner. She had been losing the ability to swallow for 2 months prior, and I heard my dad yell, "Ow." My mom had started rhythmically biting him with a distant gaze ahead of her, and her jaw twitched up and down like a nutcracker. In the emergency room, we were told she had a spontaneous hypoxic episode and had lost oxygen, and her head flooded with carbon dioxide. What they told us next was that she would have to flush out the CO2 with oxygen, and since we had no way to measure her CO2 levels at home, she would need to be monitored in the hospital ICU. That particular hospital did not have an ICU, and they initiated a transfer with our consent to another in-network hospital. What they hadn't told us was that the patient could be transferred to any hospital of their choosing. They, or in our case, both family and legal representatives, would need to arrange the transport themselves. Had we known this, we would have arranged for transportation in Northwestern and downtown Chicago, which is a highly regarded research hospital and happens to be where my mom's doctors and the ALS clinic are. There, where the hospital staff has knowledge of ALS, we would have undoubtedly been in better experienced hands. Unfortunately, this in-network hospital we were sent to, in our experience, was not equipped to safely treat my mom as an ALS patient, and that was apparent when twice in the first few days we were there, my mom had erratic breathing on the hospital BiPAP, which the doctors and staff wanted her to be on prior to the transition to our home BiPAP. I'm thankful that he had some knowledge about ALS physiology, but I have no respect for him as a human being, and there's reasons for that. Both my dad and I were in the room on that occasion in another separate time when the nurses adjusted my mom's BiPAP settings, which exacerbated the problem. The doctor, we'll call him Dr. X, came into the room and he told the nursing staff that the settings they had changed should not be used for an ALS patient, and he changed them to what they needed to be. My dad and I took 12-hour shifts, sometimes overlapping, to be with her. We were her voices in both her power of attorneys, Dad being the primary and myself being the secondary. I was horrified at the BiPAP settings incident. Why was that untrained staff for ALS lung function was allowed to change her settings? This wasn't our first scare, but it was an event that solidified to me that mom wasn't safe here. That may sound extreme, but imagine that the doctor hadn't come in and, due to the incorrect settings causing her respiratory distress, he could have killed her. One early morning, when one male nurse, Nurse B, had come into the room on his own, he announced that he would be cleaning up my mom after she had soiled herself, and I was horrified that only one person on the skeleton late night, early morning shift was going to do this on their own. It takes 3 people at home to make sure that she's safely handled if she's being rolled in bed or for any reason. One to hold her upper body, one to support her legs while she's turned, and one to do the wiping. I offered to help hold her up that morning. He accepted the help. I had to speak up to request that her head be supported with an additional pillow so her neck wouldn't be strained. He allowed this as well, but the fact that he hadn't initiated it was unnerving. I had waited about a minute before speaking up before she was turned over. I ended up supporting her paralyzed legs. In a worst case situation, padding between them might have been sufficient, but as she's paralyzed, padding won't keep the upper leg from slipping, which is painful and straining on her body. This nurse pushed her up while he was wiping her with one hand, and mom, who had rarely opened her eyes there due to the hypoxia and the heavy pain meds, unless she was in pain, had her eyes wide open and moaned. I helped support her upper body with one hand and her upper leg with the other. She's heavy, and even supporting just her legs requires effort. I stood there both physically and emotionally strained, and my stomach was in knots, and I stood quietly. After that, I placed the wedges behind her back and legs so she was propped up on her side while he held her up. At that time, she was still using a Peerwick, which is an external catheter, and which was the same type we had used at home for years. This one was always on. At home, she used to use the eye gaze to trigger a button to tell our Alexa to turn it on and off. Nurse B had explained to me that she wasn't urinating very much, so someone would be coming in to do an ultrasound of her bladder and check if and how much she was retaining urine, and if it passed a certain threshold, they would need to drain her bladder with a straight catheter. She ended up needing to be drained. It was only this same nurse in the room that had brought a sterile kit and spread her legs apart. I was sitting on the chair, feet from the bed, watching. He pulled the Peerwick out from between her legs, and there was a large stain from the bowel movement he had just cleaned up. Then he threw the Peerwick away, came back to the bed, and started to open the straight catheter container as I spoke up. I asked as politely if I could if he would be cleaning her up in front before putting the catheter in. He asked me in this friendly tone if I thought it was just urine, and as politely as I could, I asserted that it looked like a stain from her bowel movement to me. He went to get a couple washcloths. Then, as he was wiping her with the first washcloth, bowel movement stains continued to dirty the washcloth, and he was quiet, and then his expression was solemn as he moved onto the second washcloth, and he continued to wipe with more stains still gathering. Then she had a throat spasm, and you can see her neck trembling. ALS has been responsible for these throat spasms for years, and one of her ALS clinic doctors had prescribed 2 medications to combat the muscle spasms she's been on for years since they started. One is baclofen, which she takes on a daily basis, and the other is liquid lorazepam. It's Ativan. At home, we don't refer to it as Ativan and didn't even realize for years that it's the same drug. Our prescription bottles say lorazepam, and at home, we refer to them as drops more times than not, since it's a quick way to yell across the house if mom was having a throat spasm because she needs a very small dose, which we'd set up ahead of time, and very thin, small syringes from the bottle to stop the spasm while it's happening. It only takes a few seconds to resolve itself. I did read early on when she was first prescribed them for treating the muscle spasms that the medication was a benzodiazepine, which is a strong anxiety drug, the family of drugs that include Xanax and Klonopin. We keep them on hand with one next to our bed at all times, so the dose pre-filled in the syringe and the syringe in the sleeve for spasms, because when they spontaneously happen, she would gasp for breath, which is a terrifying experience no matter how many times I've gone through it. We had to fight with the hospital about having them on hand because they told us they couldn't have narcotics open on the floor. Well, benzodiazepines are not narcotics. They are controlled substances like amphetamine ADHD medications. That was what the staff kept repeating, though, narcotic, and that it violated their regulations to have them on hand on the floor unless they were a scheduled dose that the pharmacy would send up every so many hours. Well, she had never been and still is not now on a scheduled dose. This is an as needed drug. Previous to the morning with B and the catheter, my dad and I had repeatedly reinforced to the staff that when she was having these spasms, she needed them ASAP. Between that and the long call bell waits on the day we initially went through all these conversations, when I had taken an Uber home from the hospital to get sleep so that I could relieve my dad in the early morning, I was so angry that I looked up who I should be reporting this to, which I read was the Illinois Department of Public Health, and they have a phone line for complaints, and when I called, it was closed. I ended up calling an alternate state crisis number, and the woman I spoke to told me that I'd have to call back the IDPH when they opened the next day, and I told her on the phone call everything that had been happening. She was empathetic and said in a personal experience she had with a parent years ago that her family had asked for the floor manager and suggested that I try that for more immediate assistance. After those calls, I texted my dad, and he told me he had a long conversation with Dr. X. And Dr. X said that he would speak with the staff about having the medication on the floor. Dad told me not to worry about it and to get some sleep, so I did. That morning with Nurse B, no drops were on hand when the spasm started. Nurse B stood without even a word, so I had asked if he was going to get her the Lorazepam drops, and he told me that he would have to call down to the pharmacy, and it was the same situation all over again. So at that moment, I posed the question, how about I clean her up and you go call the pharmacy? So he agreed and handed me an unopened package of wet wipes and left the room without haste. So there I was, flooded with cortisol, telling my mom to hold on, and he was getting the drops, and I went through the entire pack of wipes to make sure she was clean for this catheter insert. When I was finished wiping her, I repeated that the nurse was getting them as fast as he could. And to hang on just a little longer. Her eyes were wide open again, but she had this blank stare when they were open since the hypoxic episode, and my dad and I weren't sure she was ever going to recover from that. I don't know if she was hearing me or understanding, but I squeezed her hand while I stood in front of her. And it was a miracle, despite this horrific situation, that whatever physiological change the hypoxia had put her through, the episodes which happened until she got the drops had been milder than they had prior. And despite the respiratory distress and the obvious struggle, she managed to be able to breathe through them. Since the emergency room, she had been on the BiPAP around the clock, so it's possible the ventilator was helping. She couldn't breathe without the BiPAP anymore and still can't. So she was on it at all times unless she was finishing a scheduled nebulizer treatment, and with the respiratory therapist across from me, we would have to take the mask off for a moment each time, and I would immediately put the cough assist mask, part of our home machine, to her face after hitting the start button and pressed it against her for the machine to plow air into her lungs and suck it out. Immediately after, the respiratory therapist would suction the mucus out that was pulled up by the machine, and we'd immediately replace the mask, or when she got drops, or switched masks. The hospital did not have a cough assist machine, nor, from what any one of the nurses had told me, was anyone trained on how to use one. We were asked one night to bring ours from home. Nurse B gave my mom the drops when he finally came back and the spasm stopped. Then she had her bladder drained, and I was emotionally exhausted, and Mom closed her eyes again. As Nurse B left the room, I watched him throw the empty syringe with my mom's full name and identification numbers on the label into the garbage can by the door, feet away from the medical waste box on the wall. I sat shaking with my mind racing, and I decided to quickly and quietly grab a glove and dig the syringe out of the trash. I had to move the iodine splattered sheets from the straight catheter waste, and I couldn't find it right away. I had my phone camera already opened. When I managed to locate it, I immediately took a picture and placed it back under the other trash. I also took a picture of the stained Purewick and even went into the dirty laundry bag to take pictures of the dirty washcloths. Then I tossed the glove, went back where I was sitting, and wrote every detail from the entire event and hid my notes in my bag. I peered at the clock as everything unfolded. I started taking notes the previous day to record everything happening as I was getting ready to get this report into the IDPH with hopes that they would come to the hospital and investigate. At the time, it was too early to call the IDPH, so I asked one of the staff that had come in. Luckily, it had been one that I respected and appreciated their genuine help. If I could speak to the floor manager, and later in the morning, a man I'll refer to as Z, who was the nurse manager, had come into Mom's room to talk to me. I opened my phone gallery to show him the pictures of the syringe and the Purewick. He held eye contact with me. He wore a face mask and he nodded as I spoke. He was calm and professional and told me he understood my concerns. And at the end of my grievances, he said he would be able to talk to the nursing staff, but the nurses in the white coats, which turned out to be the advanced practice nurses, he had no authority over. He started speaking with the staff right away, and that seemed to trigger some visible resentment toward me in particular, which grew as the days passed. Z said he would send the patient advocate to our room to talk later that day, and a woman I'll refer to as C arrived shortly after. She handed me her card, and the title was not patient advocate, but it was someone that had come to hear our concerns. It was on that Wednesday that my mom had woken up enough out of her haze to very poorly use the eye gaze that my dad had brought from home with the mount that he had broken down to get in the car. It's a freestanding, heavy rolling base steel pole floor mount that hangs down at home over her bed with an extended arm. He reassembled the whole thing in Mom's hospital room prior to that, hoping that if she were to wake up enough and come out of the daze she was in, she'd be able to speak. Mom had been able to type some letters out, but her eyesight was clearly affected by everything that had happened to her, and she wasn't able to communicate clearly, but she had been trying. Her pupils shot gaze point all over the screen, and she tried to navigate the keys on the speech program, but she had a lot of trouble. The staff who had come in during that time she was using the eye gaze expressed their awe, having never seen a device like that, which through someone could speak, and they asked questions about it worked. So when C came in, she introduced herself by name, not title, and said that she had heard I had some feedback about the ICU and that the ICU had wonderful reviews. I told her flatly that I'm sure that's true, but that hasn't been our experience thus far. Again, I pulled out the pictures of the syringe and the Purewick. Her eyes widened, and she replied cautiously that taking pictures in the hospital went against hospital policy. That was the start of the many occasions after I was told you can't take pictures in the hospital during our time there. C took me out into the waiting room outside the ICU, and again I aired my grievances and concerns. She had a notepad and made notes that I couldn't read, and the next time I'd see her take out that notepad, it was when security escorted me out of the ICU. Her tone was one of empathy, and she assured me that all my complaints would be escalated. She went on to ask me about when Mom got the ALS diagnosis and about what we had been through, and she expressed her feelings that ours was a wonderful story about our family who had cared for my mom and throughout her ALS diagnosis and our strong family bond. And she leaned over and threw her arm around me from next to me at the table for this unexpected hug, which in that moment I reciprocated. When we turned to Mom's room after our talk, she marveled at Mom's eye gaze despite her struggle to use it. Before she did, I asked her to keep me informed about my concerns, and she assured me that she was escalating them. She said she would, and that was another thing I hadn't heard a word about until the before you leave with security meeting. She came back to our room later that day, and my dad and I were both there, and she had changed her tune. She was very sharp about us following the rules and that we weren't allowed to engage or interfere with the staff care. This included assisting with 3 people handling jobs if only one nurse came to turn her over, like B did. C talked about our concerns. She had no direct answers to the points we brought up. I brought up how I had been standing outside my mom's room when she was having a test done, and I was on my phone and clearly able to hear Dr. X talking to the nurses at the nursing station about how to read a lung x ray. And he thought that this patient had pneumonia, and he lowered his voice after, and I don't think, which filling in the blanks, regardless of my correctness, she was going to survive, or similar phrasing had a high probability of being the last words he said in a whisper. C had walked around that story too, as if she had a doctorate in avoiding questions. Many of the staff performed the same talent while we were there, at times completely ignoring what I had said, going about what they were doing in the room, then speaking to me after as if I had said nothing at all. At that point, I spoke up, saying an old colleague had told me once that she had worked in an ICU as a nurse, and when she first started, that there had been a name on the wall and a chart in the back nursing office which indicated to give bare bones care to that person. And she was told by the other nurses that worked there that the doctor was sure this man was going to die in his condition, and the staff was to put their time and assistance into other patients in the ICU. She even asked to clarify if he had a DNR directive, and he didn't. So she asked if he were to have a heart attack and they wouldn't try to save him. I'm paraphrasing a bit, but I can't recall the terminology she used, and this was several years ago. And the answer was yes. They would have to follow that protocol, and if he died, he died. They would go through the motions regardless. And the memory of that conversation where I was told that story had been tucked away for a very long time, and it made me uneasy to think about. And after telling that story, C paused and said nothing like that would happen here, to which I shrugged, and the conversation moved on to an unresolved note. Aside from us confirming we understood, we weren't allowed to interfere with any of the staff, or we wouldn't be allowed to stay in the hospital with mom. I repeatedly ranted to my dad that my mom must have been this statistic to Dr. X, and likely to the rest of the staff. Dr. X had the audacity to say, pneumonia is the last stage of ALS, which is completely false. Not all ALS patients die of pneumonia. It is common, but the leading cause of death is respiratory failure. ALS is a terminal disease without a cure, and statistically, the life expectancy of a person with ALS is 2 to 5 years after the onset and diagnosis. I strongly believe, based on the words and actions of the doctors and staff at the ICU early on, their minds were made up that my mom was not going to survive, and they saw her as a statistic, which is the basis of my opinion that my dad and I, if we had not been there to advocate for my mom, she would have died in the hospital. The day after the visits from C, 2 nurses came in to turn my mom and clean her up, and I asked for the main nurse, Nurse R, who had been assigned to my mom that morning, to please put another pillow under her head to support it while they turned her, as one she had under her head was not going to be enough. And Nurse R told me she would be fine, and they turned her. And mom's neck was both twisted and bent over with no strength to hold the weight of herself, risking danger of snapping. It was one of those minority moments when mom had her eyes open and she was crying and tears welled. And what made it even worse, she was conscious enough that she turned her eyes to look at me while I stood feet from the bed, still my eyes matching her gaze and restricted from helping. And I told the nurse that she's clearly in pain, and I begged her to fold a pillow behind her head to support it, and the nurse ignored me. I spoke up again, and I said my mom was in pain and crying, and I asked if I could get a pillow or hold her head up, and Nurse R flatly told me with an elevated voice that she acknowledged that my mom was in pain and that they were not finished cleaning her. And she looked me in the eye, pointed to the side of the room, and commanded me to step away from the bed. I stepped aside and to the place she had pointed, and immediately nothing felt real. I hadn't touched my mom. I wasn't standing next to either of the nurses. There was no interfering and no breaking the rules, yet I was being told to step aside. I pushed past my panic after pausing and walked outside the room and called for help. I said my mom needed her head supported and the nurses needed more help, and the nurses at the nurses' station stayed seated. A couple of them looked at each other, and one walked casually to the room. So Nurse R, who had told me to step away, and the other nurse, who had been silent the entire time, had begun to put the wedges under my mom and had finished cleaning her up when my mom was in bed. Her eyes closed again, and she continued to moan, and I said nothing when the third nurse came in, and neither did any of the three nurses. After they left the room, I called the police, the non-emergency police, and I told the operator what had just happened and that my mom was being abused and neglected in the ICU right in front of my eyes. And she said that she was sending officers to our room just then. So my anxiety was through the roof, and I had just called the police. I could not believe what was happening. This is a segment quoted from my formal report. I dialed the non-emergency police line at 7:40 a.m. following an incident with Nurse R, in which my mother's pain and distress were acknowledged but not appropriately addressed. I felt compelled to take further action to ensure her safety. After repeated attempts to resolve these concerns through hospital channels, I contacted the non-emergency redacted police department to report abuse and neglect. 2 officers responded to my call. I explained the incident in detail, emphasizing my mother's pain, the lack of timely intervention, and my ongoing concerns for her safety. The officers informed me that the police do not typically address allegations of abuse or neglect within hospital settings. They suggested that I contact a lawyer. During the police visit, ICU staff surrounded the room, about 10 people, if not a few more, and both the curtains and the door were left open, resulting in a complete lack of privacy. So I'm breaking from my quote. I don't remember which of the staff had opened them, but they whipped the curtains and pushed them back as far as they could go. After the police left, I asked if I could close the curtains, and they said no, because it was a safety issue. And that was the attitude they had and the tone in their voice. So I'm going back to the report text now. The entire unit could overhear my conversation with the police and my complaints about my mother's care. Staff members exhibited hostile behavior, including scoffing, making disgusted faces, and when I presented photographic evidence of a syringe with my mother's full name discarded in the regular trash, loudly asserting that taking pictures was not allowed. The officers dismissed the photographic evidence and questioned the plausibility of my account regarding improper catheter assertion. No action was taken by the police. So I'm breaking from my quote again. It was fucking insane. Director X walked over and stood directly in the doorway, midway to a conversation with one of the officers, his arms crossed, shifting his weight on his feet, and he looked disgusted. He stood directly next to the 3 nurses who had repeatedly barked at me, "You can't take pictures in the hospital," when I had pulled out my phone. One of them literally held the side of the door, and the other 2 were grouped closely behind her, and all 3 of them peering their heads in so they could see, and one of them pumping their arms in the air behind another in this gesture while she spoke. The second officer who stood in the room, and I barely spoke, had broken his silence, and after I talked about the catheter, he says, "You're telling me," and it was about how Nurse B was going to put the catheter in my mom while she was dirty, and I said yes. When the officer who had told me straight off the bat that the police didn't deal with abuse and neglect and they saw nothing in that moment that was happening, but they didn't even take any time to look at my mom or assess her for signs of abuse. Nothing. They didn't even go over to her bed. Would they not look at a child? The police obviously weren't taking the situation seriously, and I stood there with a mob of people watching. There were staff that had been standing at the far back of the nursing station. I'd been so scared in this brand new way from this moment. I realized they weren't going to help us. I had no support. I couldn't even believe that the police hadn't insisted our conversation be private. I told the officer that I understood that, all he had was my word, and I didn't have a video of what happened that morning before I called, but I still had the proof, the syringe and the Pyrrhic. And one of the nurses at the door repeated again that it was against rules to take pictures in the hospital. I looked over at them and then back to the officer. And I said, if there's no pictures allowed in the hospital and no security cameras, there's no one watching what happens behind the closed doors of this ICU. How can anyone prove the safety and fair treatment of any one patient? There was a moment of unbearable silence, and I initiated a wrap up of the disaster conversation with the officer to thank him for his time and apologized again that he had been sent out when what I called about wasn't something the police handled. I found out then that if I wasn't happy with the quality of care that my mom was receiving, that we had the right to transfer her to another hospital, and I was suddenly relieved. And I had asked for someone immediately to initiate the transfer to Northwestern, and Z had come to the room very quickly to start the paperwork. And when I was on the phone with the neurology department for the ALS clinic, I told them she desperately needed to be transferred. I got the go ahead and call back from the office that my mom's pulmonologist said it was a good idea, and things were in motion. But they were slow, and the longer the process was taking, the more nervous energy filled my stomach with knots. This is again from my formal report. During June 26th to 27th, I experienced a marked escalation in staff hostility and barriers to communication. Nurses began selectively responding to my questions, addressing only those they chose and ignoring others. This created a significant obstacles to effective communication and hindered my ability to advocate for my mother's needs. During the same period, 3 nurses entered my mother's room while we were waiting for news about a potential transfer. They took 4 minutes to administrate the Lorazepam drop, citing the need to check the dose despite ongoing issues with timely administration. I had asked why they hadn't checked at the start of their shift for details like dosage changes, because with my mom's condition, time was a critical variable, and my question was ignored. With over 2 minutes having passed and in distress over my mom's distress during the throat spasm, I said, I know that the hospital isn't trained for ALS patients the way Northwestern was. And in response, a nurse with a white coat raised her voice, accused me of calling her uneducated, and argued aggressively, talking over me and not allowing me to clarify my statement. This confrontation was deeply distressing and left me unable to adequately defend myself due to the stress and hostility. Dr. X was subsequently informed by 2 nurses that I had called a nurse uneducated. He stated that he would believe his nurses over me and warned that I could be asked to leave if I impeded my mother's care. I clarified my intent, explained the miscommunication, and expressed frustration that the lack of credibility afforded to me as a caregiver and advocate. Dr. X acknowledged the situation as unfortunate and advised me to, quote, have some professionalism. Later that day, the head nurse introduced herself and reiterated the importance of respectful communication. She stated that no one wanted me to be escorted out, but I needed to behave respectfully. The conversation was calm and we parted ways. Ultimately, the transfer didn't go through despite Northwestern's best efforts due to a lack of available beds in the ICU. On June 26th, the respiratory therapist approached me regarding the alarm on our home BiPAP machine, which is a new addition to my mother's care in which I had not received any training. I explained that I did not want to risk altering any settings and suggested that the doctor who had configured the machine be called to safely silence the alarm during my mother's breathing treatment. Despite the hospital policy explicitly prohibiting the staff from handling home equipment, the therapist proceeded to touch the BiPAP machine. I asked her to leave the machine alone and to call the doctor if necessary. The therapist scoffed, touched the machine, and walked away. So the alarm went off whenever we had taken the mask off to do the cough assist and suction. This particular respiratory therapist I'll refer to as RTT was one of the most outrageously cruel people who I had no choice but to interact with while we were there. And every day she was on shift, I cringed and I hoped that her shift was ending soon and one of the other respiratory therapists would be coming in. A couple days prior to that, when I had been switching off with my dad very late night before he went home to sleep, he updated me on how the night was and while I was home sleeping. On June 28th, 2025 at 8 p.m. was the last documented breathing treatment that was administered to my mother. At midnight, my father, who was the primary power of attorney, inquired with the nurse about when the next scheduled breathing treatment would be administered, as these treatments were prescribed every 4 hours, which is critical to her treatment. The nurse claimed that the handwritten note from a team transition stand up stated the family had requested no treatments be administered during sleep. My father immediately denied ever making such a request. The respiratory therapist, redacted, supported the nurse's claim regarding the note, but refused to provide any information about its origin, including the timestamp, author, or access to the document. Redacted stated, "This is the way we do it. There is no log." June 30th, 2025, around 3 p.m. I went to kiss my mother and saw that the nostril fit on her BiPAP strap was cutting into her face, leaving prominent red marks. I pressed the nurse call bell and informed the nurse, redacted, pointing out the red strap marks and requesting a change of BiPAP mask. Throughout her stay, my mother had periodically been switched to the full-size scuba mask to relieve her face from strap compression and prevent skin injury. Upon removing the mask, I observed her lips were chapped and cracking, with a yellow fold across the bottom middle, possibly dead skin and mucus, and a deep cut from dryness near the bottom left corner of her lip. I requested chapstick, already present in the room, to be applied to her lips and handed it to the nurse. I also asked for ointment for the deep cut. Around 3:05 to 3:16 p.m., Nurse Redacted entered and was asked by Redacted, I'll refer to her as Nurse Q, to get the tube of light cream. Redacted returned with a white tube with blue lettering, but she stated she could not see where the cut was. Unbelievable. Nurse Q and another female nurse, curly brown hair pulled back, spent over 10 minutes adjusting the scuba mask, attempting to fit it properly without a leak. This included compressing my mother's chin into the mask. At approximately 3:07 p.m., Nurse Q called respiratory therapist RTT for assistance. After a few minutes, I suggested, maybe let's wait for the respiratory therapist. Nurse Q replied, I already called her. I knew she had already called her because I watched her do it over the voice pager radio. I was trying to subtly encourage them to stop what was causing my mom this horrible distress. The scuba mask, which covered her eyes, nose, and mouth, was leaking everywhere. The top leak on her forehead caused the plastic to flap, and it was scratching her skin from the air pressure. 3:16 p.m., RTT, respiratory therapist, entered stating she was there to do my mother's breathing treatment. She indicated that the mask would need to be changed back for the treatment. After the 20-minute breathing treatment around 3:36 p.m., RTT began putting the scuba mask back on my mother. This woman knew that the nurses were struggling with the mask, and this woman said nothing to them about how we would need to change it when she got back there to the original mask. This was the same woman that scoffed at me when the BiPAP alarm was going off. RTT asked me to help put the mask strap on my mother. I questioned why she could not ask another nurse or staff member to help. I wasn't sure if she was setting me up to be hands-on and impede my mother's care, so they had a reason to kick me out, and it was the only reason I didn't rush to help. RTT, with her hand over the mask, replied, well, it's your mom. Whatever. Let me tell you, that's a really hard statement with a tone to put in writing when you're making a report. I took a photo with my phone of my mother's condition and her dropping oxygen levels. RTT pointed at me and yelled aggressively, you can't take pictures in the hospital. Another nurse in the room then assisted instead. All the while, my mother's oxygen levels dropped while the mask was delayed being put on. I had my hand on my phone already, which I picked up when I moved the tray with the cough assist machine away, and this woman had one hand hardly holding the mask on my mom's face, and while she shrugged whatever, I unlocked my phone as fast as I could, and I took a picture that included the vitals monitor, which showed how low my mom's oxygen had dropped. No one spoke after that. The nurses in the room moved her around, and I sat down and I dialed IDPH again, and I got through. And I spoke very quietly, and my heart beat so fast I could feel my chest trembling while I was talking. I didn't know where to start, and I told the person I was talking to that I had to speak quietly because I didn't have privacy in the hospital room, and he didn't seem to be hearing what I was trying to say because he was talking as if I was reporting about a lack of privacy. And I kept stumbling to interject and clarify while he was talking over me. And he said I could always file a complaint to the complaint department email or call back when I had privacy. And then the call ended. And I sat there in that chair for I don't know how long. And by the time everyone else had left the room, Nurse Q, who had been assigned to us that day, had come in quietly, and I turned to her and thanked her for being so attentive to my mom and genuinely appreciated her help. I had thanked her throughout the day, and at that time, I wanted to ease any nervousness she might have been having, as she was one of the staff in the room that undoubtedly heard me on the phone stating that I wanted to file a complaint against the hospital to someone on the phone. Next is what occurred on July 1st that led up to the doctor calling for security. At 10:30 a.m., I was in my mother's ICU room and observed her arterial blood pressure was critically low at 73/35. I immediately rang the call bell at 10:31 a.m. for nurse assistance. At 10:38 a.m., nurse redacted, I'll refer to her as D, our assigned nurse for the day, entered the room. I raised my concern for my mother's blood pressure, as well as said that 2 or 3 days prior, another nurse told me that the ICU staff had turned off my mother's arterial blood pressure alarm because it was going off so frequently. The day before I was told this, I witnessed the alarm going off every few minutes while her blood pressure fluctuated dangerously. When I asked Nurse D at 10:38 a.m. if the alarm was turned on, she said it was. Nurse D also told me that at 10:20 a.m., she had given my mother a one-time dose of midodrine, a medication to raise blood pressure. I was not informed beforehand that this medication was scheduled or administered. As my mother's legal representative and advocate, I should have been notified, especially since my mother was incapacitated and unable to communicate. Nurse D said the midodrine had been scheduled sometime between the previous night and that morning, but could not specify exactly when, and that it had been given at 8:30 a.m. via her G-tube. I was not aware of any of this prior to our conversation. Earlier in the morning at 6:54 a.m., another nurse, redacted, told me Tylenol would be given at 9 a.m. There was no mention of midodrine or any other medication. At 11 a.m., respiratory therapist, redacted, not the one from the previous incidents, and one I couldn't have appreciated more. And Nurse D came in. My mother's blood pressure was 148/67. They said they were going to transition my mother from the hospital BiPAP to our home BiPAP machine. I asked if either of them was trained on our home BiPAP, and both said no. I requested that the doctor, who had previously made changes to our settings, come and perform the transition. Around 11:05 a.m., Dr. Redacted, I'll refer to him as Dr. V, entered and began setting up the BiPAP without speaking to me until after the procedure. I was on the phone with my father, trying to explain the situation, which led to some confusion and a brief argument on speakerphone. After the transition, I apologized to Dr. V for the confusion. He acknowledged the difficulty and left. This was a new doctor working in the ICU than the previous week. He was generally quiet, not friendly, but hadn't yet become unfriendly either. At 11:21 a.m., I asked Dr. V for a copy of the incident report from the prior Thursday night hypoxic episode caused by a staff member closing the BiPAP ventilation cap. My father was present. I was not. He told me I could not access the report or any medical records until my mother was discharged. At 11:25 a.m., my mother's arterial blood pressure was 200 systolic, and she was moaning and visibly distressed. I took a video of her fluctuating blood pressure. At 11:26 a.m., I pressed the call bell again for nurse assistance as her blood pressure reached 202/201, and she was still in distress. No alarm sounded on the monitor despite these readings. The doctor and respiratory team had left her after the BiPAP transition, and no staff remained in the room to monitor my mother. Nurse redacted, unsure of full name, but the first letter on her badge was redacted, entered after my call bell. I expressed my concern about the high arterial blood pressure. Nurse Redacted told me the arterial number could not be correct, and that the ICU staff were relying on the cuff blood pressure, not the arterial, because the arterial readings fluctuated so much. She said she would get someone to come in, but before leaving, she was focused on the monitor. No one came to check on my mother's blood pressure cuff or her status until advanced practice nurse, redacted, I'll refer to her as APNG, arrived at 11:35 a.m., 9 minutes after my call bell activation for a hypertensive crisis. Nurse APNG entered my mother's ICU room. She confirmed that the staff were aware my mother's blood pressure was high and explained that they could see her monitor readings from the nursing station. APNG stated the staff were not relying on her arterial blood pressure readings, but instead were monitoring her cuff blood pressure measurements. APNG explained that my mother's positioning could affect the accuracy of her arterial blood pressure readings. I referred to an event from June 30th when our nurse Q had repositioned my mother onto her back in the afternoon to reset the arterial blood pressure line, and at the time, the arterial and cuff readings had somewhat matched. APNG agreed, stating that when you reset the arterial line, the numbers usually align. I asked if the staff were going to reset my mother's arterial blood pressure line at that time. APNG did not respond to this question. I then asked if she or another staff member would run the cuff blood pressure measurement, but again, she did not answer. Instead, she explained that midodrine increases blood pressure and that it had been given to my mother because her blood pressure had been very low. APNG attempted to reassure me that the staff were monitoring the cuff blood pressure readings. I voiced my concern that it was alarming that no one would check the cuff blood pressure if the alarm went off, and mentioned that a few days earlier, a nurse had told me about the arterial blood pressure alarm having been turned off due to frequent fluctuations. APNG confirmed that the staff had discussed this and decided to turn the alarm back on. I emphasized my concerns about the situation and expressed that I wanted to be on the same page as the staff and treatment protocol. APNG responded with understanding and an upbeat demeanor. I asked for confirmation that the staff were actively monitoring my mother and were not concerned with the arterial blood pressure readings. APNG confirmed both, and our conversation concluded at 11:37 a.m. Context, background, 8:25 a.m. I asked Nurse D if Z, the nurse manager, was working that day. Nurse D confirmed that she had seen him and informed him that I wished to speak with him regarding an incident from June 30th unrelated to the July 1st events. Z entered my mother's room while I was present alone with her. He asked, "What's going on?" And I explained the June 30th incident as well as my ongoing concerns and the conflicting information I had received on July 1st. While discussing these concerns, I noticed a leak in my mother's BiPAP mask. Her lip was hanging out of the mask. I rang the nurse call bell. Dr. V entered the room. I informed him about the mask leak and my mother's lip position. Z held the mask on the left side of the bed. Dr. V on the right began pushing my mother's lip back in with his bare hands. I requested that Dr. V wear gloves as I did not know if he had washed his hands, but I had not seen this. He eventually put on gloves and, together with Z, adjusted the mask fit. The doctor seemed to snap when I asked him to wear gloves. He expressed his offense that I would say he didn't wash his hands, and he said that he did. I replied that I hadn't seen him and thanked him for putting on gloves regardless. You would have thought I slapped him the way he shot back at me. I raised my concerns about my mother's blood pressure and the administration of midodrine, for which I had not been given information or consented to Dr. V. He stated that my mother's blood pressure had been very low and she had received 2 doses of midodrine close together, which would explain her high blood pressure, and stated that it's not right to give her more medication to offset her high blood pressure, which I agreed, and noted I was not asking for medication and requested her blood pressure cuff be run and she be assessed. I suggested that my mother's blood pressure could also be elevated due to pain. Dr. V, with an irritated demeanor, asked, "How do you know she's in pain?" I was astonished by the question with his demeanor. I absolutely could not believe that he had said that. My tone flattened. I asked him to confirm for clarity that he nor anyone else was going to do anything for her extremely high blood pressure. Dr. V confirmed he would do nothing for her blood pressure. Before leaving, he turned around and stated that he and the rest of the staff were busy with other patients and that I could not keep ringing the call bell, emphasizing that my mother had her own nurse, D. I clarified that I never asked for anyone else or in particular. After the doctor left, I stepped outside the door of the room where Z, C, Dr. V, and a couple other staff were present in the nursing station area. I asked Z if he would provide a written statement reiterating the doctor's comment about staff being too busy for me to ring the call bell. Z, along with C, the patient advocate, who was not present in the room during the comment, and Dr. V, all verbally denied such a statement had been made while raising their voices. The night prior, I had spent hours finally researching every state and federal law and regulations so I would be able to support myself if I needed to. Dr. V then approached me aggressively, standing uncomfortably close, and accused me of putting words in his mouth. He stated he was offended and denied making the statements I described. I responded that his aggressive, confrontational behavior violated my mother's and my patient rights. He insisted that it did not and walked away. I stated I would look up the law on my phone and read it to him. Dr. V said that if I touched my phone, he would call legal and have me removed from the hospital. I told him he was welcome to do so and began to look up the patient rights on my phone. He immediately called for security, and an officer who was already present at the nurse's desk approached my room. I called my father, explained the situation. Dad was calm and told me to make sure I took all our electronics with me and said Mom would be fine, not to worry, and he would get ready to head over. I kissed my mom and I told her that my dad would be there soon and I would see her soon too. She was asleep or seemed to be, but if she was listening, I wanted to comfort her so she wouldn't be scared. I stepped out of the room. I announced I was leaving on my own accord. Then C and Z stopped me and asked if I would talk with them before leaving. I agreed, provided we could have privacy, and moved to the conference room next to the waiting room. I was lugging 3 heavy bags through the hallway with me when C asked to talk before I left, and I didn't even turn to look at her when I replied. I kept moving. I glanced at her when she asked if I'd like helping carrying one of my bags, and I declined. And there was this massive amount of tension in the air. I had no idea what to expect, but both C and Z didn't seem to have a threatening air about them at the time, and Z asked if I wanted something to drink when we entered the room. C acknowledged that my claims were serious, abuse, neglect, and malpractice, and wanted to listen. She took out a notebook. I discussed my concerns about monitoring and alarm management, as well as the June 30th incident with RTT. C asked if I had discussed the blood pressure issue with the doctor and how I knew my mother's blood pressure was high. Z explained the clinical rationale for the administration and dosage of Minidrin. C questioned why I had not brought these concerns to her earlier. I explained that after reporting Nurse B's behavior earlier, he was back at work the next day, despite assurances that my concerns would be investigated and escalated, which undermined my trust in the process. I showed a photo of my mother's dry, red, and chapped lips and red marks from the BiPAP straps from prolonged BiPAP use without proper care, and C asked, "What does this picture mean to you?" The conversation continued, and I eventually asked C if she would provide her written consent for me to record the rest of the conversation. She refused, stating, "No, I will not." I responded that I would continue the conversation after consulting legal advice. I stood up, picked up my bags, opened the door, said nothing more to Z or C, who stayed seated without another word, and with a nod, I started to walk alongside the very, very tall security guard toward the elevators, who spoke only twice during the walk. First was at the elevators. I headed toward the ones I used when I would leave and come back, and he directed me to a separate set of elevators on the opposite side. What threw me for a loop was that after I stepped into the elevator, I turned around to wait for the guard who had opened the door to the stairs across from the elevator door while gesturing his intention, and he looked like he was talking into his radio or about to. The elevator door closed after the stairway door had, and I made it to the lobby floor before he did. So for a moment, I stood there waiting for him. It was a short walk to the entrance, and I told him I needed to call an Uber home. And instead of waiting with me, he walked me to the sliding doors at the entryway and gestured outside while telling me there was a bench that I could sit and set up my Uber. He walked back in the lobby, and I walked to the bench, drowning in adrenaline. I called my father to inform him I was leaving the ICU. At the time of my departure and leading up to it, there were no nurses present in my mother's room. According to the medication records later reviewed and told to me by Nurse D upon my request to know when the last time narco, was given, my mother was administered narco as needed pain medication at 2:00 p.m. July 1st, after I had left the hospital. At this time, my mother was nonverbal, unable to communicate, and incapable of providing informed consent for medication administration. My dad was still home, getting ready to go when I got home, and after a short talk, I collapsed into my bed and felt a mixture of nervous energy and exhaustion. I sent an email from my computer to Z, gently asking him if he had time before his shift's end, and if he wouldn't mind stopping by my mom's room in case any of the nurses needed help with my mom's mask. I also sent a standalone screenshot from the Electronic Code of Federal Regulations 42 CFR 482.13B2, Condition of Participation, Patient's Rights, which reads, the patient or his or her representative, as allowed under state law, has the right to make informed decisions regarding his or her care. The patient's rights include being informed of his or her health status, being involved in the care planning and treatment, and being able to request or refuse treatment. This right must not be construed as a mechanism to demand the provision of treatment or services deemed medically unnecessary or inappropriate. I hit send and I closed my eyes until I heard my dad's phone ring. My dad answers his phone on speaker more than half of the time, so when he picked up and an unexpected call came in, I heard C's voice and I was suddenly alert. I could only make out a few words of hers and some of what my dad had been saying from 2 rooms away, but the tone of the conversation sounded both awkward and friendly. I overheard bits of my dad saying that he heard what happened at the hospital and he would be heading over there shortly, and they spoke for several minutes, and when their call was over, my dad walked over to my room and I asked him what he said. His recap included that she told him when I left the hospital I was very upset, to which my dad casually told her that I was emotional about my mom's condition and she wanted to know if she could speak with me and apologize, to which my dad had told her just as casually that I was in bed and it was best to let her cool down. Me being her. My first thought was, what the hell? I was curious what wording she used and what story she had told him about what details she disclosed or withheld, but being exhausted when he said after he thought everything would be fine and that he was heading out and that he would ask while he was at the hospital if I would be able to come back, I let sleep take me. Those weren't even all of the things that happened while we were in the hospital.